Hey everybody, this is Dr. Sattler here again with your question of the week. Okay, so let's look at this week's question. The nurse is reviewing a client's record and notes that the primary health care provider has documented that the client has chronic kidney disease. On review of the laboratory results, the nurse most likely would expect to know which finding. You have 1, increased number of white blood cells in the urine, 2, decreased red blood cell count, 3, decreased hemoglobin level, or 4, elevated creatinine level. So let's look at each of these. So obviously you have to know your lab values and what each one does. And so when we're talking about our white blood cells, you know that the white blood cells are a part of the immune system to try to prevent infection. And so if we have increased white blood cells, that would mean we have infection. So if we have white blood cells in the urine, we likely have a urinary tract infection, increased white blood cells. Decreased red blood cell count. So let's look at 2 and 3, decreased red blood cell count and decreased hemoglobin level. Now, we know that the hemoglobin is a protein in the red blood cells that carries oxygen throughout the blood. So if we have, low hemoglobin, low red blood cells, we probably have low oxygen, which would lead us to anemia. You probably see a person, with that might have anemia. And then elevated creatinine level. Creatinine is one of those lab values that can help us determine kidney function. And so if we have an elevated creatinine, that would mean decreased kidney function. So what is our question asking us? The person has chronic kidney disease. So if a person has chronic kidney disease, their kidney function is probably going to be decreased. So that means you're going to see elevated creatinine level, because increased creatinine level would be an indicator that they had decreased kidney function. All right, so that would be our response, elevated creatinine level. Okay, so as we stated, our answer was number 4, elevated creatinine. So let's read the rationale. The creatinine level is the most specific laboratory test to determine the renal function. The creatinine level increases when at least 50% of renal function is lost. A decreased hemoglobin level and red blood cell count are associated with anemia or blood loss, and not specifically with decreased renal function. Increased white blood cells in the urine are noted with urinary tract infection. Okay, everybody. Well, if you enjoyed this week's question of the week and you'd like to see more like them, please consider subscribing to my YouTube channel. Have a great day, everyone. See you next week.